Hi, I'm Abdallah Sabah from JACC Intervention Social Media, and with me here is Dr. Samir Kapadia from Cleveland Clinic. He's the chair of the Department of Cardiovascular Diseases, and thank you for being here with us today.
Pleasure is mine.
And congratulations on the late-breaking clinical trial. What could you tell us about the clinical trial on the WATCHMAN FLX, the early data?
So, the SURPASS is a registry, and over about 7 to 8 months, there are 16,000 patients in the registry. So compared to the Pinnacle FLX, which was the pivotal trial, which has 400 patients, this is 16,000 patients, so 40 times as many. And this is done with, in 7 months, so it's about 2,000 patients per month in the country, with so many new centers and so many implanters. So the idea is to find out if we are going to get results similar to what the pivotal trial showed. Mm-hmm. Are we going to have the same kind of mortality, stroke, embolization, things like that you saw in the pivotal trial? Mm-hmm. And I can share with you the data, but it is very important that what we found is that in this large number of patients with so many operators, so many hospitals, it's very, very similar to Pinnacle FLX in the sense that it's very similar to what we saw in the pivotal trial. So patients are older, patients are sicker, but almost all the major complications are less than 0.1%. So 1 in 1,000 or less, and especially all of the things that you would look at procedural complications are much less than that. So this is amazing. So if you are going to say that you are going to have procedural death or procedural stroke or device embolization, which is less than 1 in 1,000, or in some of the instances is less than 1 in 5,000, then this is a huge accomplishment that the device is safe and can be used by a lot of people. And we have a 45-day data. So this is not just procedural data, but we have about 90% of the patients coming back for 45-day outcome. So we have device-related thrombosis data, which also shows that the device-related thrombosis is not very high. It is very acceptable rate of 0.2%, not very high. And even the 45-day stroke or death rate is not increased compared to the Pinnacle FLX, statistically not different. So all of these things will suggest that the technology can be very easily expanded to large number of patients and large number of people, and especially the patients have high CHEDVAS score compared to one that we recruited in the trial. So this is a huge accomplishment for the field of both interventional cardiology as well as EP, because both of the groups participate in the deployment of the device.
Absolutely. And how do you think this is going to shape or influence future clinical trials with other devices in the market?
No, that's true, because so there are some areas that we did not discuss in this particular trial, but we do have some data to say that how patients were treated with different anticoagulants like NOAC versus warfarin. And this will shape the new trials to say that whether we are going to use NOAC, whether we are going to use device-to-device comparisons, how we are going to have the periprostatic leak assessed, and all of those things, and what is the implication of that. So stay tuned, because we are going to have more in-depth analysis of this SURPASS registry as we go to the next level. But there are incredible amount of data available from this registry. Currently it's 2-year follow, but we are going to even link it with Medicare to have long-term follow. So this will be a tremendous resource for future information.
Thank you so much. And live from CRT 2022, this is Abdallah Sabah and Dr. Samir Kapadia.